Welcome. In this video, we'll be exploring dilated cardiomyopathy, a serious heart condition that affects the heart's ability to pump blood effectively. We'll delve into what causes it, how it impacts the heart, how it's diagnosed and treated, and what the future holds for those living with this condition. Dilated cardiomyopathy, or DCM, arises from a variety of factors. In many cases, the exact cause remains unknown, termed idiopathic DCM. However, common culprits include genetic mutations, with about 20% of DCM cases linked to inherited genes. Viral infections, such as those caused by adenovirus or parvovirus B19, can also trigger DCM. Other contributing factors include excessive alcohol consumption, drug abuse, particularly cocaine, certain medications like some chemotherapy drugs, pregnancy-related complications known as peripartum cardiomyopathy, uncontrolled high blood pressure, and nutritional deficiencies like thiamine or selenium deficiency. Autoimmune diseases such as lupus and sarcoidosis can also, in rare instances, be a cause. In DCM, the heart's left ventricle, the main pumping chamber, becomes enlarged and weakened. This dilation causes the heart muscle to thin and stretch, reducing its ability to contract forcefully. Consequently, the heart pumps less blood with each beat, leading to a decreased cardiac output. The chambers of the heart can dilate, resulting in valvular regurgitation where blood leaks backward through the heart valves. Over time, this weakened pumping action can lead to heart failure, as the heart struggles to meet the body's demands for oxygen and nutrients. Dilated cardiomyopathy affects people of all ages and backgrounds, but is more common in adults between the ages of 20 and 50. Men are more likely to develop DCM than women. The prevalence is estimated to be around 1 in 250 to 500 individuals. The exact incidence may be underreported due to asymptomatic cases or misdiagnosis. Knowing these statistics helps us understand the scope of this health issue. The signs and symptoms of DCM can vary depending on the severity of the condition. Early stages might be asymptomatic. As the disease progresses, common symptoms include shortness of breath, especially during exertion or while lying down, fatigue and weakness, swelling in the ankles, legs, and abdomen due to fluid retention, an irregular heartbeat or palpitations, dizziness or lightheadedness, chest pain, which can be a sign of reduced blood flow to the heart muscle, and persistent cough or wheezing. It's important to note that these symptoms can also be associated with other conditions, so a thorough medical evaluation is crucial for accurate diagnosis. Diagnosing DCM involves a combination of medical history, physical examination, and diagnostic tests. A physical exam may reveal an enlarged heart, abnormal heart sounds, and signs of fluid retention. An electrocardiogram, or ECG, can detect abnormal heart rhythms and signs of heart enlargement. An echocardiogram, using sound waves to create images of the heart, can show the size and function of the heart chambers and valves. A chest X-ray can reveal an enlarged heart and fluid in the lungs. A cardiac MRI provides detailed images of the heart muscle and can help identify underlying causes like inflammation or scarring. In some cases, a heart catheterization and biopsy may be performed to assess blood flow and examine the heart tissue. While DCM doesn't have distinct subtypes in the traditional sense, it's important to classify it based on its underlying cause. For example, we can categorize DCM as ischemic if it's due to coronary artery disease, alcoholic if it's related to excessive alcohol intake, or familial if it's genetically inherited. Classifying DCM based on the cause helps to guide treatment strategies. Treatment for DCM focuses on managing symptoms, improving heart function, and preventing complications. Medications commonly prescribed include ACE inhibitors or ARBs to lower blood pressure and reduce strain on the heart, beta blockers to slow heart rate and improve heart function, diuretics to reduce fluid retention, digoxin to strengthen heart contractions, and anticoagulants to prevent blood clots. In some cases, implantable devices like pacemakers or implantable cardioverter, defibrillators, or ICDs may be necessary to regulate heart rhythm or prevent sudden cardiac arrest. For severe cases, heart transplantation may be considered as a last resort. While not all cases of DCM are preventable, certain lifestyle choices can reduce the risk. These include maintaining a healthy diet, avoiding excessive alcohol consumption, refraining from drug abuse, managing high blood pressure, and treating underlying medical conditions. Regular exercise, under a doctor's guidance, can also promote heart health. Genetic counseling may be beneficial for individuals with a family history of DCM. The prognosis for DCM varies depending on the severity of the condition, the underlying cause, and the individual's response to treatment. Some people with DCM can live relatively normal lives with medication and lifestyle modifications. However, others may experience progressive heart failure and require more aggressive interventions. Recent research focuses on gene therapy to correct genetic mutations associated with DCM. development of new medications to improve heart function and reduce inflammation, and advanced imaging techniques to better diagnose and monitor the disease.